Hello, everyone. We are beginning the deep muscles of the shoulder unit. So we are going to begin with the rotator cuff muscles. And this is on page 74 and 75 in your textbook. So right now we're going to start to peel some of those superficial layers back and see what's underneath. Here we go. Start with your visible body and let's take a look at these rotator cuff muscles. So the rotator cuff is not necessarily a thing. It's not something you can point to and go, oh yes, that right there is the rotator cuff. It is a series of 4 muscles that help to stabilize the head of the humerus in the glenohumeral joint. As I have mentioned before, the glenohumeral joint is the least stable joint in the body because of the large humeral head and the really teeny tiny glenoid fossa. So the rotator cuff is a series of 4 muscles that help stabilize the head of the humerus in the glenoid fossa. We have 4 muscles that make an acronym called SITS. S-I-T-S. We have supraspinatus, infraspinatus, teres minor, and if we turn this around here on the anterior side, we have subscapularis, S-I-T-S, supraspinatus, infraspinatus, teres minor, subscapularis. S-I-T-S. That's the easiest way to remember the 4 rotator cuff muscles. Okay, so let's get to origins and insertions. They are all really easy to get to except for subscapularis. Supraspinatus is up here. And it is partially covered by trapezius, but I'll explain that in a minute. Let's go to the next page. Okay, so supraspinatus originates in the supraspinous fossa. Okay, so the muscle has a T in it, supraspinatus, but the fossa is supraspinous. Okay, so there's a little bit of a difference there so that you can, keep that straight in your head. The supraspinatus muscle sits in the supraspinous fossa. Then the tendon of that muscle ducts underneath the acromion process here and inserts on the greater tubercle of the humerus right here. Supraspinatus is the big chunk O muscle that you can grab. Trying to look into the little screen here so I can see. It's the big chunk of muscle that you can grab here at the superior shoulder. Some of that muscle is trapezius. So if I turn my head to the side, you can see this right here is trapezius, this little bit right there. Remember, trapezius is very thin, but it's superficial, right? So supraspinatus is deep to trapezius partially. Right, so here's upper trapezius, then this big chunk that you can grab onto that's deep to trapezius, that's all supraspinatus. So everything that you can grab here is supraspinatus, that big thick muscle there, okay? And trapezius is the little thin one on top of that. All right, so supraspinatus originates on the supraspinous fossa of the scapula, of course, and inserts on the greater tubercle of the humerus. It abducts the shoulder and stabilizes the head of the humerus in the glenoid cavity. As I mentioned, that is going to be an action for all of these muscles. But abduction is really what it does. Okay, abduction. Remember, upper traps also abducts the shoulder, so they act together in that action. Now, inferior to that is the infraspinatus muscle right here. It is separated, of course, from the supraspinatus by the spine of the scapula, which makes sense. So infraspinatus originates in the infraspinous fossa and then comes over here and inserts on the greater tubercle of the humerus. There's going to be a pattern emerging, you will see. Infraspinatus is entirely accessible. So most of this muscle here, you can easily palpate and feel just by palpating right below the spine of the scapula, okay? Now, infraspinatus is a lateral rotator because remember, this is the rotator cuff. So we have laterally rotate the shoulder. So remember what lateral rotation looks like. It's when the humerus moves towards the posterior of the body, right? That's lateral rotation. It adducts the shoulder, so it can also pull the humerus towards the body a little bit and stabilizes the head of the humerus and the glenoid cavity, of course. Infraspinatus has a little helper, and that's teres minor. So they are synergists. Infraspinatus has teres minor. Which muscle had teres major as its little helper? Do you remember? Yep, that's right. Latissimus dorsi had teres major as lat's little helper. In this case, infraspinatus has teres minor as its little helper. And teres minor and infraspinatus are true synergists. They do the exact same actions. So teres minor originates on the lateral border of the scapula. And this is going to say the upper 2/3 of the lateral border of the scapula. And then it inserts on the greater tubercle of the humerus. So all three of the ones that we've talked about so far, supraspinatus, infraspinatus, and teres minor, they all insert on the greater tubercle of the humerus. Easy peasy. Teres minor, being a synergist to infraspinatus, is going to do the same thing. So it's going to laterally rotate, adduct, and the shoulder and stabilize the head of the humerus in the glenoid cavity. Okay, so let's take a look at these real quick. All right, so this image actually makes supraspinatus look really flat and dull, but it's not. It's kind of thick and round. But I'd also mentioned that the tendon of supraspinatus dips underneath the acromion process here. And that's going to be significant in disorders like tendinitis for supraspinatus, because it's every time you lift your arm, the supraspinatus tendon is going to sort of smash up underneath the acromion here. And over time, that can cause issues with the tendon itself. This is infraspinatus, and this is teres minor, right? See, they go in the exact same direction. Their fibers go in the same direction. They insert at almost the same spot. So they are indeed true synergists. What's this one right here? Yeah, that one's teres major, right? That will be lat's little helper. Okay, so last but not least, we have subscapularis. It's this guy right here. Subscapularis originates in the subscapular fossa. So this is going to be on the anterior of the scapula. And of course, the anterior of the scapula is not exactly accessible because it is against the rib cage. So this muscle is not entirely accessible. It's not going to be easily palpated like the other rotator cuff muscles. All right, so it covers the entire subscapular fossa, comes across the shoulder joint here and inserts on the lesser tubercle of the humerus. Lesser tubercle of the humerus, okay? So the other three are greater tubercle of the humerus. This one is lesser tubercle of the humerus. Now, because of its position and its insertion on the lesser tubercle of the humerus, it will medially rotate the shoulder. Okay, so it's pulling that lesser tubercle towards the midline, right? Not towards the midline necessarily, but I'm sorry, into rotation. So towards the anterior, okay? Which is going to medially rotate the shoulder and of course, stabilize the head of the humerus in the glenoid cavity. That's their main job. Even though it says they are rotator cuff muscles, their main job is stabilization of this joint. Okay. Now, subscapularis, teres minor, and infraspinatus all rotate the humerus. Supraspinatus does not. It is simply a stabilizer and abductor, but its role is very important in holding the head of the humerus sort of where it is so that the other muscles can rotate it. Okay, that's why it is grouped in with the rotator cuff muscles. So if we go back here, let's take one more look at subscapularis. You can see it is on the anterior scapula. It is in between the rib cage and the scapula. This particular muscle actually is a little more posterior than serratus anterior, because serratus anterior attaches to the ribs. So you've got serratus anterior here and then subscapularis here. So they'll sit together like this, but serratus anterior is more anterior. Okay. And then, of course, subscap comes across the joint here and inserts on the lesser tubercle. Okay. All right. So this was pages 74 and 75. The next few pages are all about palpation of the rotator cuff muscles. You will be doing this in class. However, I do encourage you to try palpating these ahead of time, because you're going to be working on the rotator cuff a lot. Most people that come in with shoulder issues, it's the rotator cuff that is going to be involved. At least one of those four muscles, possibly more than one in some cases. So palpation and knowing exactly where these are and what they should feel like is really important. All right, so that's it for the rotator cuff set. I will join you back here soon.